So scientifically, there is no immediate threat for the European region at this point in time, based on the information we have from China, because the variants which are circulating in China are those also circulating in Europe. However, it is important to keep public health confidence by the population. So, as I was mentioning in the statement, we do acknowledge that a number of countries, based on the precautionary principle, are implementing some measures while we anticipate more information to be shared available at public databases. But it's very important that those measures, those precautionary measures, are based on science, are proportionate, and particularly are non-discriminatory. I was mentioning about the XBB.1.5 variant, which is now dominant in the United States, which also is showing up in our region. And this underscores the importance that we cannot enter 2023 blind in our own region.
And at this particular time, they're looking very, very closely at the sublineage XBB 1.5 in order to determine whether or not this would represent a new variant of concern or continue to be designated as an Omicron variant of concern. We look at several things. One is the antigenic distance, or the distance, evolutionary distance away from other circulating variants and viruses. And second is the specific characteristics of that variant and of the virus. And for that, we need information both on the virology, but also on the epidemiology linked to the spread of this particular virus. And at this stage, we've seen it spread very quickly in the USA. We need to understand what basis that spread is linked to, whether it's a higher growth advantage due to transmission, to the binding to the human receptors, whether it's immune evasion, and all of these studies are ongoing at the moment. And we also need to pick up these characteristics in other settings where potentially the population immunological profiles might be different. And so for that reason, we need to reinforce our ability to pick up the cases here in Europe, where we know that it's already spreading at small numbers at the moment, but increasing. And we need to very rapidly link the data we have on the emergence and spread of this variant to the epidemiologic data to understand what potential public health impact it will have. And then we'll be able to make a determination on whether this constitutes a new variant of concern that deserves its own name.
Entering 2023, countries across Europe and Central Asia need to redouble their efforts to implement proven effective strategies and avoid being complacent. This means urgently reinvesting in and recommitting to enhanced virological and genomic surveillance, including wastewater surveillance as feasible. This means investing in and safeguarding the health workforce, whose precarious situation in many places could undermine the effective provision of health services. This means continuing the 5 pandemic stabilizers that have proven so effective, increasing vaccine uptake in the general population, administering additional vaccine doses to priority groups, promoting mask wearing indoors and in public transportation, ventilating crowded and public spaces such as schools, bars and restaurants, open space offices and public transportation, and providing early and appropriate therapeutics to patients at risk of severe disease. Further, as we have seen, these measures can also reduce the impact of other respiratory infections, in particular influenza, that our health services are struggling with at this time. Science, surveillance, responsibility. All of these must come together all the more as we enter the 4th year of the pandemic to ensure a future for all.